What's up, everybody? My name is Demetri Kofinas, and you're listening to Hidden Forces, a podcast that inspires investors, entrepreneurs, and everyday citizens to challenge consensus narratives and learn how to think critically about the systems of power shaping our world. My guest in this episode of Hidden Forces is Dr. Scott Sherr, the founder of Integrative HBOT, a worldwide telemedicine practice that consults and educates patients and clinics using Dr. Sherr's novel approach to hyperbaric oxygen therapy, including cutting-edge and dynamic protocols, comprehensive laboratory testing, targeted supplementation, and much more. This is an unusual conversation for me to have on this podcast, not because it's health-focused, but because the inspiration for it resulted from a personal journey that I've been on for the last several months. Most of you at this point know that I am a brain tumor survivor. I underwent surgery and radiation in the summer and fall of 2013 to treat a series of debilitating symptoms stemming from that tumor, including dementia, anterograde amnesia, and general cognitive decline that I wrote about for the Atlantic's Quartz magazine in 2015, and about which the CBC did a short documentary in the same year, both of which are linked to in the episode description for those of you who want to learn more. I was fortunate to go through all of these interventions without any discernible side effects, though some of those side effects, specifically those caused by radiation, can take time to emerge. In the last few years, I have noticed a change in my memory. Specifically, I've had trouble recalling events and will often lose my train of thought and ability to multitask. I know it's hard for people who listen to my show to believe this, because I've learned to manage it, and to be fair, my memory used to be pretty extraordinary, so decline from those levels isn't obvious to most people. So after several years of noticing these changes, I decided to take a trip down to Florida in March of last year for a battery of tests, including neural imaging and cognition. The results showed volumetric loss of white matter in my brain. In other words, parts of my brain appeared to have shrunk, which could explain the memory issues. While no one can say for sure that this is a result of radiation injury to my brain, it is one of the more reasonable explanations I've been able to find, as well as the possibility that it could be a symptom of long COVID or some combination of the two. So what does this have to do with hyperbaric oxygen therapy? Well, hyperbaric oxygen therapy, or HBOT for short, has a wide range of health applications, some of which include treating people with radiation injuries, dementia, as well as general cognitive decline. In December of last year, I published an article for our newsletter subscribers, which you can also read by joining our newsletter at hiddenforces.io/newsletter. The newsletter was about my decision to undergo what turned into 3 months of daily hyperbaric oxygen treatments, 60 sessions in total, lasting 2 hours each at 2 ATA, which is a measure of underwater pressure combined with the weight of the atmosphere. What you're going to learn about in today's conversation is not just how that experience went and how it helped me, but whether or not it can help you, and how extraordinary hyperbaric oxygen therapy is as a non-pharmacological therapeutic with remarkably broad health benefits. As usual, this episode is broken into 2 parts, the first of which is meant to help you understand more precisely what hyperbaric oxygen therapy is, how it works, and the various protocols associated with it, including the different types of chambers, pressures, and durations available for those interested in pursuing treatment. In the second hour, Scott and I explore the wide range of potential health benefits, medical applications, and use cases associated with hyperbaric oxygen therapy, including rehabilitation from strokes, the healing of persistent wounds, neurological conditions, severe anemia, skin burns, long COVID symptoms, and of course, radiation injury, to name just a few. We also discuss treatments that can be used in parallel to hyperbaric oxygen therapy, such as senolytic therapy, stem cell therapy, targeted supplementation, various fasting protocols, and much more. If you want access to that part of the conversation, and you're not already subscribed to Hidden Forces, you can join our premium feed and listen to the second hour of today's episode by going to hiddenforces.io/subscribe. All of our content tiers give you access to our premium feed, which you can listen to on your mobile device using your favorite podcast app, just like you're listening to this episode right now. If you want to join in on the conversation and become a member of the Hidden Forces Genius community, which includes Q&A calls with guests, access to special research and analysis, in-person events, and dinners You can also do that on our subscriber page. And if you still have questions, feel free to send an email to info@hiddenforces.io, and I or someone from our team will get right back to you. And with that, please enjoy this incredibly exciting and educational conversation with my guest, Dr. Scott Sherr. Dr. Scott Sherr, welcome to Hidden Forces.
Thanks for having me, man. It's good to be here.
This is a long time in the making. I don't usually take like 4 months to bring a guest on after I initially speak with him. So you're kind of setting records right from the start, Scott.
Well, I try. So it's nice to be here. I know sometimes the on-ramping for a unique kind of physician as I am can take some time. So I appreciate the time being here.
So in the introduction, I've given people a sense of what this episode's about. The specific reason why it took so long since we first spoke was you and I spoke before I started hyperbaric therapy.
Right.
Both because I was interested in finding somebody, in other words, to have on the show after I was done with hyperbaric oxygen therapy, because I wanted to make sure that the therapy worked for me. And I wanted to have some sense of, because I was worried about it not really being effective. And I didn't want to go into it with all these big expectations and having done a podcast about it and, projecting onto it all these expectations.
Sure. And
it turning out to have been underwhelming. So, which is not the case, which is why you're on. But also I wanted to speak with you to help me prepare for it. And that's sort of part of what you do for other people that you work with. And in fact, I was able to implement some of your suggestions, including lowering the pressure from 2.5 to 2. And unfortunately, as you know, I wasn't able to get all of the air brakes in that we talked about. But we're going to talk about all that, Scott. Before we do, I want to introduce you to our audience. So what type of medicine do you practice? And how did you get into this field of hyperbaric oxygen therapy, rejuvenation medicine, longevity science? I'm not sure what the terminology is.
Yeah, well, I mean, it's kind of all those things to some degree, but my physician background is I'm an internal medicine physician. I trained conventionally at the University of Maryland in Baltimore. I did my 3 years of residency after my medical school there, and I did my basic work, if you want to call it there, in Baltimore. I spent about a decade there. But if you go further back, I'm the son of a chiropractor, and I was always out of the box as a kid. I never really knew what conventional medicine was. And I had this kind of high-minded idea of that I could bring this conventional world that I didn't understand at all when I went to medical school alongside or bridge that chasm between the conventional world and the alternative world that I kind of grew up inside of. And so as I was going through medical school and residency, it was always in the back of my mind, even though I got sometimes tantalized by some of these other specialties like dermatology, where I could make $700,000 or $800,000 without having to do a whole lot, except look at people's skin or do colonoscopies for the rest of my life, or sit in front of a radiology screen or in the radiology suites looking at pictures. But thank goodness I'm not doing that, because those docs won't be around much longer because of AI, as you likely know. So I got tantalized by all those kinds of things, but I always kind of came back to my base, which was, how am I going to help people bridge that chasm between the conventional and the alternative world? There was no other words at that time. There wasn't integrative medicine. There wasn't functional medicine. This is back in 2003 when I started medical school. So when I was in my medical school in my third year, I had to do all these rotations, as most medical students do. The first couple of years are typically, you're just studying, you're in the lecture halls, you're learning from PhDs about various types of things. And then in your second 2 years is when you do your rounds to try to figure out what kind of doctor you want to be. And so one of those rotations was in a place called shock trauma, which is in the University of Maryland, very well known. It's a place that people from all over the world go to train from the military branches, even foreign military branches come there because of all the shock and trauma. Unfortunately, that has been in Baltimore for a long, long time. And so when I trained there, I saw a lot of crazy stuff, as you can imagine. This is back before work hours had changed for medical students. And so we were doing 30 hours on call every 3 nights for 2 weeks. And this is a common schedule that they do there. I don't know if it's done anymore, but it was pretty intense. We were in the shock trauma bays. We were seeing people come in with gunshot wounds and severe infections. But down in the basement was this gigantic submarine-looking thing called the hyperbaric oxygen chamber. And I had no idea what it was. And I just saw that some of these people were coming in with severe burns, with severe infections, with severe trauma, with their limbs hanging off and crazy stuff. And they would go into the chamber and they'd come out like a new person. Sometimes they'd be on a ventilator when they went in. And then when they came out, I noticed they were just breathing on their own, which was really crazy. And this is something like for carbon monoxide poisoning, for example, which we can talk about how hyperbaric therapy works. But in essence, I was very shocked by what was possible in these chambers. And I was very tired during those 3 weeks of rotation. But afterwards, I started going into the science about what I actually just saw in this gigantic chamber. And I was kind of floored that we weren't using it for any number of other things that research had shown that it was being very, very effective for around the country, around the world, really. And I found out in the United States, there was 15 indications or 16. And in places like China and Japan and Russia, there were 60 indications for hyperbaric therapy. And so as I finished my residency and I was kind of starting to figure out what I wanted to do with the rest of my life, I moved to California with my wife. At that time, I was starting a fellowship at Stanford, and I became a medical director of a facility in San Francisco doing hyperbaric oxygen therapy. And then over a decade of now practicing hyperbaric therapy, my way of practicing has evolved dramatically from understanding kind of the physiology to it to understanding that the key for hyperbaric therapy is not just the chamber itself, but what are you doing before, during, and after hyperbaric therapy to truly leverage the technology, and making sure people are going in at a time that's most appropriate for them, and using a foundational approach of cellular health is really important, and various other factors. But it's been a long road, but now I consult with people all over the world, like yourself, that are thinking about using hyperbaric therapy in their own practices, in their own lives for their own conditions. And then also I work with clinics all over the world that are looking to integrate hyperbaric therapy with other modalities and other practices that they have at their clinics.
So we'll have a chance to get into this in more detail later, but how soon after you discovered hyperbaric therapy as a resident did you actually try it for yourself?
That's a good question. It wasn't probably for about 3 years, because when I first started learning about hyperbaric therapy, this was back in medical school. And so when I was in medical school, as I mentioned, I saw this gigantic chamber in the basement. I had no idea what it was. The technicians and the doctors told me out about it, and I got really excited about it. And then I started looking around for other opportunities when I was in medical school. So I went to a wound care facility because we use hyperbaric therapy classically for wounds, especially diabetic wounds and wounds from radiation, as you know. But the diabetic wounds are probably the most common reason that hospitals are treating patients with hyperbaric therapy. And so it wasn't until I moved in to California, to the Bay Area in 2013, when I became a medical director of the facility, when I first had my chance to really go into a chamber and get the experience myself.
The reason I also ask is because I imagine that back then, there weren't as many freestanding facilities that were available to people that didn't have one of the officially sanctioned medical conditions associated with hyperbaric therapy, right? So we'll have a chance to get into that. So top level question, what is hyperbaric therapy and where did it come from? What is its origin story?
Yeah, so when you think about hyperbaric therapy, there really are two things that are happening. One is that you're increasing atmospheric pressure, and the other is that you're increasing inspired oxygen. And we can get to what both of those things mean in a minute. But the basic mechanisms, the basic physics of hyperbaric therapy was discovered a long, long time ago. The first pressurized chamber was developed about 400 years ago. And this is because all they really did at that time, they didn't understand oxygen. They didn't understand what was in the air itself at all. But what they didn't understand is that if they completely sealed a room, a metal steel chamber, that they could either blow air into it and change something, or they could suck air out of it and they could change something else. So that became a hyperbaric and a hypobaric environment. So for a long time, for almost 300 years before oxygen was really understood, all we were doing in these chambers that they were developing, and they really had no research behind for a long time, which was either making a hypobaric or HYPO, so decreased amount of air in a chamber, or hyperbaric, increasing the amount of air in the chamber. And this is the pressure part of hyperbaric therapy. So we can start there because it's the one that is more difficult to understand actually, because the oxygen most of us understand.
Is there any connection to diving in its origin story? In other words, did they discover this because people were going underwater and coming out, and they found that there was some kind of correlation between their symptoms and what pressure they were at when they returned back underwater?
Yeah, so that's the evolution of it. So what happened is that these chambers have been around for a long, long time, as mentioned. And when they started building bridges, the most famous bridge in this case was the Brooklyn Bridge. And the Brooklyn Bridge, that was the first time there was a description of something called the bends, or it was called the Grecken bends at that time. Because what would happen is that some of these workers that were sunk down underneath the water in these places called caissons, where they were building out and digging out for the pylons of the actual bridge. So they were in these like dugout containers basically underneath the water. And then they had these elevator shafts that would go from the surface to the deep water itself. And what would happen is that when people would come out of these things, because as you can imagine, if you're below the sea, if you're 20 feet or 30 feet below the sea, all that water is exerting an extreme pressure, but they didn't really understand that at the time. And so what would happen is that some of these workers would come out and they would have these severe neurologic symptoms. Some would be paralyzed, some would die, some would have seizures, and nobody really knew what was happening. But what would happen if they didn't die and they went back to work the next day, all of their symptoms would go away, because they were going back into these pressurized environments. And so it was at that point that it was realized that something was happening with this pressure. Something was happening when people were going down to this pressure and coming up. And if they went back to this pressure, back to work the next day, if they didn't die or weren't debilitated, they would actually heal and feel much better. And actually the chief architect of the Brooklyn Bridge was paralyzed during the making of the Brooklyn Bridge because of this particular physiologic shift that happens called the bends. And we understand now what the bends is, and it's really based on two physics laws that are central to hyperbaric oxygen therapy. One is called Boyle's law. Boyle's law is a law that states that if you have a bubble of air and you pressurize that bubble, the more of that bubble is going to get smaller and smaller and smaller until potentially it goes back into a circulatory state, in this case, nitrogen. And then the other law that's important in hyperbaric therapy is called Henry's law. Henry's law states that the more pressure you put on a gas, the more gas is going to go from a gaseous form to a liquid form. And then in the opposite direction, the more pressure you take off of a gas or take off of a liquid, the more of it's going to go into a gaseous form. So both of these are taking place in a decompression or the bends type of physiology, where you have two major gases that are in your bloodstream. You have oxygen and you have nitrogen, but you have a crap ton more nitrogen than you have oxygen, actually. And there's a crap ton more nitrogen in circulation in the air around us than we have oxygen. Typically, it's about 21% oxygen in the air. So maybe I'll start with oxygen, and then we'll go back to pressure for a minute, because I think it'll make it easier for people. So we know that at sea level, there's 21% oxygen in the air that you're breathing. So here in Colorado, where I am, it's going to be about 16% oxygen. And where you are in the lovely islands of Greece, you are basically at sea level. And as a result of that, you are at 21% oxygen, or maybe a tad bit more. But in general, when we're at either my altitude or you're at sea level, our body has physiologic mechanisms to allow us to maintain our physiologic function, so all of our needs, with that amount of oxygen in circulation, because we have something called a red blood cell. A red blood cell carries something called oxygen, and we have this other molecule on our red blood cells called hemoglobin. And there are 4 sites on a hemoglobin molecule for oxygen to bind. There are 250 million hemoglobin molecules per red blood cell. Times 4, you have 1 billion oxygen molecules that can be carried per red blood cell. So oxygen is carried on red blood cells. Your red blood cell amount or number is typically what allows you to have what's called your oxygen carrying capacity. So what the body does is it picks up oxygen from your lungs, it takes it throughout your body to all your various needs, and it dumps off the oxygen that you need. And there's also reserve there, typically, so you don't dump off all 4 sites of that oxygen. You typically have some reserve if you're going to get chased by a lion, or going to go hunting, or you're going to be running a marathon or whatever it might be. So you have to have extra there just in case. So as mentioned, for most of us that have normal physiology, that's all we need, because if you measure something called a pulse oximeter, which is a pulse ox, something you put on your finger, most people know this from COVID now, and they know that if you have like a 92, 95, 97, so on average, most of us have about 97 to 100% of those sites saturated at sea level or at the altitude that you're used to living in, because your body has physiologic mechanisms. Here in Colorado, what happens is that I have a hormone that gets released called Epen, which is released from your kidneys. And this is also something that is very famous in doping circles from cyclists like Lance Armstrong and others, because what EPO does is increase your red blood cell number. The more red blood cells you have, the more oxygen carrying capacity that you have. So that kind of leads me to, what are the ways that we can increase our oxygen carrying capacity? Now, the major one I just mentioned is you can come to altitude, come to Colorado, hang out with me, go running. And that's why all the ultra marathoners and all the other, high performance sports athletes often come to Colorado. or they get a hypobaric tent, HYPO baric environment. They get, because the further up in altitude you go, so for example, Mount Everest, right, the least amount of oxygen in the air versus the Dead Sea, which has the most oxygen in the air because it's below sea level. And so that's where pressure comes in, which we'll get to in a minute. So in general, we have oxygen carrying capacity increasing when you increase the number of red blood cells in circulation, or you take a medicine like Epen that increases the red blood cell number, or you increase your red blood cell number by giving yourself a transfusion of blood, which people do before races as well. It's not technically doping, but it is doping. And then the other way to increase oxygen carrying capacity is to increase the amount of oxygen in your circulation in your plasma. So the plasma is the liquid of your bloodstream. It has very little oxygen in it at baseline, at sea level, but you can increase the amount of oxygen in your plasma up to 1200% or more. Actually, at 2 atmospheres of pressure, you can increase it to 1200%. And so that's where pressure comes in, because pressure has that Henry's law going on. The more pressure you put on a gas, in this case, the more pressure you're putting on oxygen, the more that oxygen is going to go from a gaseous form to a liquid form. So you can increase the amount of oxygen in circulation, not just on those red blood cells, but also in the liquid of your bloodstream, because you've simulated the pressure you feel under a certain amount of seawater. And remember, water is heavy. And so that heaviness is what we can simulate in a hyperbaric chamber. So we can simulate pressure at 12, 15, 25, 33 feet, 45 feet of seawater, depending on what's needed. And we can drive more oxygen in circulation. So to sum up, you have increased inspired oxygen and increased atmospheric pressure. The combination drives a huge amount more oxygen in circulation, and that's what shifts your physiologic function. That increased oxygen in there has 3 major roles. The first is to increase the amount of oxygen in circulation. The second is to create stress on the system so that the system actually can modulate itself from an epigenetic perspective, which is how your genes are expressed. And the third way is by pressure-induced mechanisms on their own.
Fantastic. So you covered a gazillion things, that all of which I want to get into. Before we do, let's just clarify something. When you're undergoing hypobaric therapy, or you're up in Colorado and you produce more red blood cells, your body is also acclimated to that environment. So presumably you're still getting roughly the same amount of oxygen. If you live in Colorado right now and you've been there for a year, you're getting the same amount of oxygen as you would be if you were at sea level, even though you have more red blood cells, correct? Is that roughly accurate?
Right. It's distributed, right? Because you have to have more red blood cells to be able to compensate for there being less oxygen in the air.
Right. So if you train up in the mountains and you come down to sea level to fight or to compete, you're going to have more energy, more oxygen carrying capacity, because you have more red blood cells than you would otherwise need. So my question is, this kind of skips ahead, but since you brought up Colorado, I wanted to ask you it. First of all, one, what is the reason that you live in Colorado? Is there a health benefit associated with that? But more specifically, what happens when someone who lives in Colorado does hyperbaric oxygen therapy? So you have more red blood cells than I do right now. Mm-hmm. If you got into a chamber and we use the same protocol, what would be the difference between your treatment experience and mine?
Actually, very little overall, because to answer your first question, why do I live in Colorado? That was more of a family decision for me. But there has been some studies looking at the sort of sweet spot for longevity. And it seems to be around 4,000 to 6,000 feet. And it's unclear as to why that is. Although I have some ideas overall that I think that the increased red blood cell density, the number, and the increased oxygen carrying capacity does have some physiologic shifts over time that does things like decrease inflammation and increase with healing, et cetera. But those are just theories at this point. Nobody really knows. I mean, most of the places they looked at are places that of, like in Sardinia and other, in the Greek islands, where they have like these longevity communities, are often in hilly environments because they are just walking more up hills on a regular basis. So is it the actual altitude that matters, or is it that you're walking up hills more? I don't know.
The exercise
itself, right? So I don't know exactly about the longevity benefits of being up here, but certainly it's a beautiful place to live. That's for sure.
So explain to me why our experience would be not that much different, even though you have many more red blood cells than I do.
Right, because the relative change of pressure is the same. So this is getting a little bit more technical, but for example, like I'm here at 16% oxygen and less pressure. So when I go to a hyperbaric chamber, I'm going to have a relative change in my physiology that's the same as yours. The delta is the same. Whether you're at sea level and you go to hyperbaric pressure, or you go up where I am and go hyperbaric pressure, it's the same thing. And I get that question a lot because I have people that get chambers for their house, for example. And they have, well, my gauge won't go to 1.5 atmospheres or whatever. I'm like, well, no, because you're not starting at the zero. You're starting at, a different pressure, less pressure than you would if you were at sea level. And so as a result of that, it doesn't go all the way up to the pressure that they're supposed to go to, but the relative change there is the same. So it's a delta is what it matters.
Is that because atmospheric absolutes, ATA, which is the measure of pressure that we're talking about here, captures both the pressure induced in the tube, in the chamber, as well as the atmospheric pressure?
Yes, it has to.
So at a higher, you have, okay, that makes sense. That makes sense. So we're getting a little more technical than I intended earlier on
question.
because I want to establish certain things. Certainly for people that are into this stuff, they'll appreciate that. But I wanted to establish some foundation first. So next question, I want to give people a sense of this before we proceed any further, which is who can benefit from hyperbaric oxygen therapy. So not just the medical conditions that are commonly treated with HBOT, which I do want to talk about, but the broader category of people that can potentially benefit from it. Who are they?
I often say that if hyperbaric therapy is going to be helpful for you, it's going to be when, because with the basic physiology, as I was alluding to earlier, is that we have these three things happening: more oxygen in the system, more use stress, so good stress typically, so helping the system regenerate, revitalize itself, and pressure-related mechanisms. And what that means in physiologic terms is that the first thing that happens is you reverse low oxygen states, so reversing hypoxia. And so this is really important, and there's been a number of studies looking at hyperbaric therapy in the acute setting for heart attacks, for strokes, for traumatic brain injuries, for spinal cord injuries, for acute limb trauma, as I was mentioning earlier in some of my experiences at shock trauma. And this is because you can reverse low oxygen states because you can drive so much more oxygen in circulation. And then over the long term, over a longer hyperbaric protocol, you can actually see rebuilding of blood vasculature in areas that have been damaged. So you have what's called angiogenesis. So short-term, reverse low oxygen states for acute trauma, acute stress, and then long-term, you have angiogenesis with a new building of blood vessels. That's number one. Number two, there is a decrease in inflammation and decrease in swelling. So this is very, very important in acute trauma as well. If you have acute inflammatory cascades that you're trying to downregulate, if you have swelling in places like your brain, you don't want that. Hyperbaric therapy can be very helpful. There was a study done several years ago on traumatic brain injury. Just 3 hyperbaric sessions over the first 3 days of somebody with severe TBI had holes cut out in their skull because of swelling, significant decrease in mortality and morbidity if just 3 hyperbaric sessions were done in the first 3 days. And this is the most effective and the most importantly seen in people with the highest amount of brain swelling. So swelling is a big deal. So hyperbaric therapy can actually decrease swelling and inflammation initially. And then over the long term, what it does is decrease all of these inflammatory things called cytokines, or these chemicals that regulate inflammatory cascades and make it very difficult for the body to heal. TNF alpha, interleukins, these are the names of some of those. That's the second thing. The third thing that hyperbaric therapy is doing is it releases something called stem cells. Stem cells are these baby cells that our body is always producing, typically in our bone marrow, and also has these kind of baby cells in various types of tissue, including our brain, that hyperbaric therapy stimulates the production of, mostly the release of these stem cells from these areas to go to areas where there's inflammation, where there's infection, where there's degeneration, et cetera. So, and then what happens is that these stem cells mature into the types of tissue that you need in those particular areas. So new brain, new heart, new cartilage, new bone. There are studies on all of these types of tissues that you can regenerate and revitalize because of the stem cell release. The fourth thing that's happening is that you are increasing your immune system function. So immune system is really important, obviously, for healing from an acute issue, but also for the long term, you need to have the immune system modulated in ways that's going to help regulate the immune system, regulate inflammation. So you have the initial steps of the immune system getting upregulated, and you have the long-term steps of the immune system being modulated. The next thing that hyperbaric therapy does, I think I'm on number 5 now, is that you have an anti-infective capacity to it. So you have, especially for bugs that do not like high oxygen environments, hyperbaric therapy can be acutely cytal or kill those kinds of bugs that do not like high oxygen environments. The most common ones that we see are the ones in our mouth, the ones in our abdomen, and then something like necrotizing fasciitis, which is a flesh-eating type of bacteria, a Clostridium bacteria that's what I saw in medical school. And I saw people with these crazy infections, going to hyperbaric therapy and salvaging their limbs, which is something that oftentimes these patients need to get cut off, unfortunately. Back in the 1990s, they used to have these crazy stories in the paper about flesh-eating bacteria. It can be pretty gnarly. But anyway, so those are the 5 major things that hyperbaric therapy is doing. So if you think about it, most of us can use some help in one of those 5 areas. Then the question just becomes, is it appropriate to use hyperbaric therapy at this particular time for your particular goals or conditions? And, or do you have an acute issue? Or do you have more of a long-term or chronic issue where it may be better to do other things before you start hyperbaric therapy, for example?
Okay, great. Again, you touched on a bunch of stuff that all of which I want to talk about. And I think most of, if not all, is in my rundown. Before we get to it, actually, let me tackle one of them. So acute versus chronic.
Yeah.
I want to just share an anecdote. This is something I experienced early on. So I was able to intuitively understand from my experience that acute injuries, particularly if they're hypoxic or proximately hypoxic, respond the best to hyperbaric therapy. So 2 examples I can provide. One, which might sound less remarkable to people, is on occasions where I didn't get great sleep, and that was atypical for me during the course of my therapy. I actually slept really well and had very intense dreams. Not sure if that's something that's universally shared, what it indicates, but I'd be happy to hear about it from you. So, but in the off cases where I didn't get great sleep, my hyperbaric sessions were at 12 p.m. and I had to drive an hour plus to get there. So I would leave the house around 10 something, but it was basically like a few hours. It was like 4 or 5 or 6 hours after I'd woken up already. So by the time I get out of the chamber, I no longer feel underslept. I feel great. And that was one area where I really experienced that, this major shift. I didn't have to sleep. I didn't have to nod off. None of that mattered. I came out feeling great, especially if I hadn't slept well. And another experience I had, because I combined this with a very intense exercise regimen during the course of my therapy that I've continued since. And what I experienced was, besides, I did experience some moderate improvement in my recovery, though I feel like the biggest changes I saw were oddly enough, in performance, even though the hyperbaric therapy was happening after my workouts. I was using it as a recovery tool as opposed to a performance enhancement, but I actually experienced it in terms of the work output I was able to do and my heart rate. But that aside, about a few weeks into my workouts, I slammed the outside of my ankle onto a very heavy piece of metal, and it exploded. Like when you hit something so hard that it cuts open. It wasn't sliced, it cut open, it exploded, and it was, red and blue. And I'm like, whoa, boy, that's going to be there for a few weeks. Because at this age, I'm 42, it takes some time for these things to heal. And I just intuitively, I didn't even think about the fact that I was doing hyperbaric. And I will tell you that within days, I remember being like, wait, I had an injury. I had forgotten about it.
Yeah.
And I looked down, it was hardly visible. And I swear to God that that's true. It was that big of a shift. And that's when, I was like, oh, of course that's the case. All these people that are coming in with diabetes, with open wounds into the hyperbaric centers are coming in because it's accelerating the healing of their wounds.
Right.
So, that was something I understood intuitively, but also from reading the literature that you're citing, and from, I guess I could say, my own experience of having seen significant cognitive improvements, which I presume are either related to the radiation injury that I had to my brain, if I had an injury based on the radiation that I got,
right,
which I've talked about, or maybe long COVID. Regardless, I've seen both of those. And I just wanted to validate that.
Yeah. Yeah. I mean, I think that when it comes down to your experience, it's actually very funny, because that's how we know that hyperbaric therapy can help with things like strokes, or help with things like diabetic neuropathy, or help with things like hearing. Because if you lose your hearing suddenly, is because you'd had people like diabetics that were going into the chamber for their wounds, because we know it heals wounds, but then all of a sudden their strokes would get better, or their hearing would get better, or their neuropathy would get better. So it's sort of like these beneficial side effects of being in the chamber, which I think is fun and exciting. And you point to the fact that on the acute side, what hyperbaric therapy can do is really leverage your physiology and make it work faster. So all the things that I mentioned, hypoxia, inflammation, swelling, stem cells, all that's happening very, very, very fast. And so if you have an acute issue, you're going to see a significant benefit. And from a surgical perspective, and even from an injury perspective overall, we're usually talking and quoting somewhere about 20 to 70% faster recovery for an acute issue. And so that's a pretty wide range, but that also depends on the type of injury, depends on the person and how well optimized they are before they have the injury. Back in the early days, we were doing Tommy John surgery recoveries, which is this baseball player surgery where they get this thing on their elbow. I think it's their elbow and maybe their shoulder as well. And these guys are typically out for 12 months. And we were getting them back on the field in 6 or 7. So significantly better. And I've worked with a number of athletes in this case already. So you mentioned the acute versus chronic aspects of how you think about hyperbaric therapy. So acute injuries, fantastically responsive very, very quickly. And so I often say, if you have an acute issue, hyperbaric therapy will help you with almost very little other things that you would ever need at the same time. So basically, when I think about hyperbaric therapy, I think about it in like a before, during, and after. What are you going to do to leverage this technology? But when it comes to an acute issue, you don't have to worry about it really. You just get into the chamber and you heal. Just make sure you go to the hospital if you have a stroke or a heart attack or something like that. I mean, it's obvious, but in some circles, I remember learning hyperbaric therapy from this old Navy guy. And he was giving us a lecture. He's like, yeah, I lost my vision. I was thinking of having a stroke. And so I just went downstairs to the chamber, did some sessions. It was better. Then I went to the hospital. I mean, I don't recommend that. I think you should go to the hospital first and then go and, get hyperbaric therapy as quickly as you can. But so from an acute issue perspective, fantastically effective at healing things very, very fast. But if you have a long-term issue, something that's been going on for a long period of time or a long-term goal, then it's a different ecosystem that you still have to think about before just getting into the chamber. And that's where a lot of people in my community, I think, are sometimes missing the boat, where they're just, if you have a hammer, everything looks like a nail kind of thing, where if you have a chronic issue, oftentimes it's better to wait, or at least to have a conversation about what are you going to do before, during, and after to make it better and make it more leveraged in the ways you want.
I mean, totally, because a lot of the patients that were undergoing this therapy, and I underwent this therapy at a hospital because I had, you couldn't do it at a hospital if you don't have insurance coverage. I got the insurance to cover it,
right?
But you could get insurance to cover it at a different medical center that isn't a hospital. But there were a lot of people that were going there that were older. It was almost old people, which, by the way, makes sense too, because honestly, who can afford to do hyperbaric, the kind of therapy that I did? I'm not talking, the financial burden is one thing. That's not the biggest burden. The biggest burden is on your time. The amount of time that this took out of my schedule was enormous. And I wouldn't have been able to do that at the very least if I didn't work for myself. And it was still very, very difficult. So I think part of it's just old people have the time to do it. I've seen it also in these centers in Florida. So because a lot of these old people were going, they were also very tired. And I saw that different people reacted to it differently. So presumably some markers of health correlate with being able to have a better experience when you're actually doing it.
Absolutely.
Another thing that you mentioned is inflammation. How much of the inflammation, of the benefit related to inflammation, has to do with senescent cells, which secrete cytokines, among other things, inflammatory cytokines? How much of it is that, and how much of it is some other factor? Like, what is the mechanism by which it reduces inflammation or helps to reduce inflammation?
So when you're looking at long-term goals or chronic issues in the chamber and trying to heal them, what you're looking at is a hyperbaric protocol. So it's not typically 1 or 2 sessions in the chamber. Like you and your experience, Demetri, it was more 30, 40, sometimes more sessions in the hyperbaric chamber.
I was 60 sessions, daily
60 sessions,
yeah.
right. So up to 60 sessions is possible. And the reason for those number is that what you're doing there is shifting your genetic expression of your genes. This is called your epigenetics, right? You don't change your genes because you're born with those, but you do change how these are expressed over time. And many, many different things do this. And this is this field of epigenetics. Epigenetics is a great and burgeoning field. I have a colleague of mine, Lucia Ronica, who works at Stanford, and she and I collaborate a lot on various types of projects, and I'm very much into understanding that what hyperbaric therapy truly is doing in these longer protocols is shifting your epigenetics and shifting the expression of various genes, at least 8,000 of them in our studies so far, that are responsible for growth, responsible for inflammation, responsible for decreasing inflammation, and responsible for preventing cellular death or apoptosis. Now, you mentioned something about senescent cells. Senescent cells are these types of cells called zombie cells in the lay press. These are cells that don't divide. They don't really work anymore. They cause inflammation. They're associated with degeneration, cancer, death, all those fun things. And so there was a study that you were alluding to back, I think it was published in 2020 now, from an Israeli group over at the Asaf Harofei Hospital in Tel Aviv, that showed if you did 60 hyperbaric sessions that you vastly decreased the number of senescent cells in the body. And the question became how, and nobody really knows exactly how that works at this point. My guess is that what hyperbaric therapy is doing one of two things. Either it's allowing those cells to apoptose or die. And that's actually a good thing in this case because the body's recycling cells all the time. Most of us don't know that, but we're constantly recycling our cells, recycling our mitochondria within our cells, which are the part of our cells that make energy because of all that oxygen that we're breathing, by the way. And so we think that the senescent cell populations could be going down because you are just regenerating these cells or that you're killing these cells. We don't know. But either way, there's less of them after a hyperbaric protocol. And certainly that is an aspect of why there's less inflammation ongoing or as a result of a longer hyperbaric protocol. The other reason is that some of these genetic expression changes downregulate the production of some of these inflammatory mediators like cytokines and other things like cytokines like TNF alpha, for example, which is a very common one that's elevated in multiple different types of inflammatory and autoimmune conditions. So I think that's really why we think or hyperbaric therapy is such a profound anti-inflammatory. And there have been some studies that have looked at the power as an anti-inflammatory compared to something like a steroid. And steroids are often used as an anti-inflammatory for something for swelling as well, especially in the brain, but in other locations. Some studies were done in the inflammatory bowel disease literature, looking at Crohn's and ulcerative colitis and seeing how hyperbaric therapy used in these contexts could be as powerful as steroids in these patients. Many of them were refractory to treatment in these studies, and they were able to go into remission actually using hyperbaric protocols.
Are there any studies that show a clear connection between inflammation and the propensity to develop diseases like cancer?
Oh, 100%. Yeah. I mean, we know that the two main sort of base level issues that we have, the first one is mitochondrial dysfunction. This is the part of our cell that makes energy. And because we make energy and we're so energy needy, our bodies are so energy needy, we have a lot of byproducts of energy metabolism over time. This is called reactive oxygen species, oxidative stress. This is what starts causing inflammation. There's other reasons for inflammation as well. When it comes down to it, it's either mitochondrial stress and or inflammation that are the basic building blocks or foundation of disease and degeneration over time.
So you mentioned the benefits it has for immune system. That's something I want to talk about again. It's something that I had in my rundown to discuss. Before we do that, I also want to mention another experience that I had during the course of therapy, which was very superficial, but somewhat, I'd say, kind of mind-blowing. Waking up in the morning and all of my wrinkles like disappearing within like just a few minutes of waking up. Like I noticed that the wrinkles just went away faster and my skin looked better. And I'm curious, is that related to collagen production? And what do we know about the effects of hyperbaric therapy on collagen production? Because what I was experiencing then, unfortunately, I can tell you, maybe it didn't all go away, but that specific benefit that I saw in my face is not something that persisted, a few weeks after I ended my HPOT treatments.
Yeah, so there are some studies showing that hyperbaric therapy can increase collagen production. And so the way you'd actually make it stay is by actually doing some stimulatory kinds of things for your skin at the same time. So we have people that are doing these brushing and cupping and microneedling and dermal abrasions and things like that. And so that's hasn't been well studied, but there are some studies showing hyperbaric therapy does increase collagen deposition, but you need to have a reason for it to do that. And that's kind of the idea, is that you need to stimulate a particular area to help it heal, whether it's your brain or your knee or your skin. And so hyperbaric therapy on its own can very much help if you have wounds or locations that the oxygen needs to go to more primarily. But if you want to focus on a particular location, you can do various kinds of things in a integrative context to help with that. And a good example would be, let's say a good example is if you have a brain injury and you're having a hard time with thinking or remembering or executive function, which is your attention, basically. So you can do something like brain exercises when you're in the chamber to help you remember and concentrate better, because when you're in the chamber, you're going to get more oxygen to those areas that you're working, wherever that is. You could put somebody in a neurofeedback kind of device before they go into the chamber, stimulating that brain to increase blood flow and to increase the need in that area, and then go into a chamber and leverage what you just did and increase the amount that you're going to be able to get oxygen to that tissue. So you can do that to your brain, you can do that to your skin, you can do that anywhere, and you're going to stimulate more oxygen to get to that area. And as a result, you're going to get more of whatever you needed, right? So in the case of if you're a collagen producing kinds of goal, that's great. You can go do that. If it's more that you have to heal your brain, you can do that. Or if it's your toe, like there's various types of mechanisms and technologies, practices, supplements, all those kinds of things that you can think about that can help with those kinds of maneuvers depending on what's required. But in essence, yes, we can increase your immune system function in the chamber. And it's not going to be a permanent thing. It's typically while you're in the chamber. But if you have an acute issue, that's an extremely important thing because you're going to leverage all those types of cells that are required to help recovery overall with the immune system. And you're also going to see the mechanisms at play where you can modulate and actually regulate the immune system better while you're in the chamber over the long term.
So you mentioned doing performances in the chamber. This is probably a good opportunity to talk about the difference between Monoplace and Multiplace chambers.
Sure.
Most of the Monoplace chambers I've seen, including the one I used, were acrylic, which is like see-through.
Yep.
And because they're Monoplace chambers where the oxygen is infused within the environment, I'm not wearing a mask except for when we're doing air breaks. I want to talk about air breaks. I wasn't able to do any of that stuff. It's quite unfortunate, actually. I wanted to. So all I got to do was watch movies, and I got to watch the entire 6 seasons of The Sopranos again.
Lovely.
But I will say,
yeah,
what is cool about this is that one of the problems I was having, and I always try to make things work for me in the best way that I can. So I took a positive approach to that. And I decided, okay, I'm going to watch The Sopranos. And what am I going to do? I'm going to try to remember everything. Well, not try to. I'm just going to try to be focused. And I didn't even have to try to. It came naturally. Because one of the problems I was having before I started therapy, one of the areas where I saw problems to my memory was episodic memory. The inability to weave together the parts of a story to kind of, tell if I had a phone call, for example, and my wife said, well, who did you talk to? I could tell her who I talked to. But if she asked me, what did you guys talk about? I struggled to tell her. And upon reflection now, since I've gotten out of the hyperbaric chamber, after having gone through this long period of doing this therapy, I wonder how much of that is actually just focus and that whatever I was dealing with was affecting my ability to focus. I felt mentally tired. But the point is that after I would come home, I would tell her everything about the episode that I just watched and every single character's name and what they did and just weave all that together. So that was really remarkable.
That's awesome.
Again, So to bring it back to the different types of therapies, you have Monoplace and Multiplace. What is the key differences beyond what I said, if there are any? And then more importantly, which one is appropriate for who? Like, why would you want to do one versus the other?
Sure. So, certainly in a Monoplace, you have less room in there to do things. That's for sure. So, Monoplace is a single occupancy chamber. They come in different varieties. There's what we call soft or mild-sided hyperbaric therapy. These are chambers that go to less pressure, less oxygen. They're typically made of nylon or some sort of other kinds of material that's very stretchy kind of deal. You can have these at your home. You can also have these at clinics all around the country, all around the world as well. These chambers can go up to about 1.5 atmospheres. Usually about 1.3 is the max, but some go to 1.5. And those chambers are non-medical grade. They can be used for wellness kinds of reasons. The only medical indication at 1.3 is acute mountain sickness, which is if you go up to altitude, come visit me, and you get pulmonary edema, you can go get into one of these soft chambers and reoxygenate. You get about 200 to 300% more oxygen up to about 1.5. You can get, if you're breathing 100% oxygen at 1.5, you get about 500 to 600% more oxygen. So it's not a small amount of oxygen. And these are chamber pressures that are great for neurologic kinds of things. Not so much radiation injury, but
you're talking about soft chambers.
So basically up to about 1.5 atmospheres. If you take the type of chamber material out and just think about the pressures themselves, you have chambers that can go to up to about 1.5 to 1.8 atmospheres is when we're really looking at mostly focusing on neurologic types of injuries, sometimes systemic, but mostly neurologic, neurocognitive optimization, et cetera. We can get into more detail if you like about this later, but to kind of go over the types of chambers, you have your monos, which are your single occupancy, and then you have your multiplace chambers. And these chambers typically have multiple people in them. The pressures in a multiplace chamber can range as well. They can be as low as a 1.3 atmospheres in some time in some locations, but for the most part, at hospitals, at clinics, they go very, very deep, and they have multiple people in there at the same time. And they also can have what's called an attendant, somebody in there that's working with you, that's not the patient, but the person that's actually helping you do stuff. And so in some of these chambers, you get people doing physical therapy with patients in there. You can have them doing occupational therapy in there with patients. You can have some of these chambers are now have iPads or iPads that are something similar to an iPad in there that are rated for pressure, so people can actually do various types of games or various kinds of brain-related activities inside the chamber, because There was a study that was done also by the Israelis showing that multitasking capacity goes up in the chamber. And that's because you have more oxygen around, you have more energy available. And so your brain's not going to get as tired typically. And so you can do more of these multitasking kinds of exercises and see benefit. And so when I talk to patients about hyperbaric therapy, the one thing that I always try to emphasize, number one, I think primarily is that it's really important that you relax or that you are relaxed in the chamber, because do we heal when we're stressed? The answer is that we don't. We heal better when we're parasympathetic or we're in a relaxed state. So number one is, if you're going to watch movies in there, don't watch John Wick #3 or something that's going to get you crazy or stressed inside the chamber. Typically, you want something that either you've seen before, like The Sopranos for the 6th time, or something that you know that'll be relaxing, because you want your body and your mind to be relaxed. So that's when blood flow can go where it needs to go most easily. If we're stressed, it's just not going to happen as easily. Okay. So if you're not stressed, great. The next step is, what can you do there to leverage the oxygen? And in that case, if you have very little maneuverability, if you're in a monoplace chamber, you can do things in your mind. Like, I have some of my patients that have brain issues do serial 7. So you start at 100, you subtract 7 until you can't do it anymore, which is really painful, even for people that don't have brain injuries. But the better you get at it, for example, that's a concentration task, right? You can have them do concentration tasks. Sometimes I'll have them speak to people outside of the chamber if they have a problem with speaking, for example. Like, you have a little phone in the chambers that are at hospitals typically, or at these outpatient clinics. You can talk to the person inside the chamber with this phone. It's like an intercom system, and just chat with them, how they're doing, and talk to them about their day and work on these kinds of things. But when you're in a multiplace chamber, then you have more leeway as far as what you can do, because you can move around. And so that's when you can get very complex and very creative in the things that you do with patients to try to work on regaining their function. But the other thing to mention is that what I'll often do in patients that don't have a lot of capacity to do this is that you can leverage the amount of oxygen in circulation, because you've gotten all this amount of oxygen in the circulation now. So at 2 atmospheres, which is the equivalent of about 33 feet of seawater, you have 1,200% more oxygen in circulation. Okay. This oxygen is going to last in circulation for about 30 minutes to an hour after you get out of the chamber. Now, the physiologic shifts that just happened, and this is something related you talked about earlier with recovery from exercise, for example. So the physiologic shifts that happen because of being in a hyperbaric chamber last about 24 hours or so, if you just do one session. Now, this builds up over time. This is what we're changing with your epigenetics, as we described. But that physiologic shift is most profound in that 30 to 60 minutes after you get out of the chamber. So what you can do in certain patients that have enough energy is that you can actually have them do their rehabilitation directly after getting out of the chamber, because they have more oxygen around. So physical therapy, occupational therapy. I mean, on the extreme other end of things, you have others that will bring hyperbaric chambers, the mild-sided units, the soft-sided units, to races or to competitions, get in the chamber, do their 60 minutes in the chamber, and then go do their race, because that's going to increase their oxygen carrying capacity for 30 or 60 minutes. So you can leverage that oxygen post hyperbaric therapy to do work, or you can just use it to recover too, which is what most people do. But this is just kind of giving you a feel of what you can do with that extra oxygen around.
Yeah, again, lots of things there to discuss. I'm going to move us to the second hour, Scott. Before I do, I'm going to ask you one more question about the units themselves.
Yeah.
And then in the second hour, we're going to get talked about frequency, duration, different types of protocols, hormesis. I'll actually list out a few things that I want to discuss. So, okay, great. So we talked about soft versus hard mono chambers. And it's also important to point out here, in the mono chambers, the oxygen is pretty much always infused in the chamber, correct? It's not something that people are
both ways.
Not going into a mono chamber. Yeah, I mean, you could theoretically do it, but I imagine like the whole point of being in a mono chamber is that you don't have to wear a mask, right?
Well, no. In hospitals, typically they do have 100% oxygen in the chamber itself, but 100% oxygen is also quite flammable, as you likely know. And
well,
so
that was what I was going to say. Exactly. Yeah.
It has to be done under very specific regulatory conditions. So a lot of the outpatient clinics that have monoplace chambers that go to deeper pressures, 2 atmospheres, for example, will actually have it with that. The chamber itself is pressurized with sea level air, and then the patient will either wear like 100% oxygen mask or put a hood on their head. And these are also what's done in a multiplace chamber as well. But it's a safer way to go from outpatient clinics, because you don't have as much oxygen in the air in the chamber itself. So it becomes less flammable. And it's also much more expensive to fill up a chamber with 100% oxygen than it is to have somebody wear a 100% oxygen mask. And the mechanisms and logistics around that are more challenging for people because there's a huge spectrum of what's going on in the outpatient world. And I think you know a little bit about this too, Demetri, as far as what hyperbaric facilities can do, what they are doing, you know, who's supervising these clinics, what kinds of chambers that they have. And so for the most part, many of these, I'd say about at least 50% of these clinics do not have a full-time medical director. So they don't have a full-time medical physician, so that the clinic owners are the ones that are running the facility. And there are some challenges with that, but and as a result of that, many of them are not going to opt for the 100% oxygen in the chamber because it's too complicated logistically as well. But I would say that for people that have more like issues with their face or they have a hard time with a mask, it's certainly better to be in 100% oxygen if possible. And it's a nicer experience, but it's not as easy to come by outside the hospital is what it comes down to.
Hey, you kind of addressed most of the questions that I was going to ask about home versus clinical units, which was my last question. The reason I also wanted to bring up that distinction between mono and multiplace with respect to oxygen infusion versus wearing a mask is because people might have been sitting around wondering, well, Demetri, why did you watch The Sopranos? Why didn't you just bring your iPad? You can't bring anything in there. And it's not just an iPad. I mean, I was constantly a little nervous every time I would go in to make sure that I didn't forget anything. I went through a whole checklist. And the staff was pretty good at remembering also to do that. But you have to take off everything. I have to take off my ring. I got to take off everything. So, because any little spark could lead to an explosion. In fact, I've seen news reports of people who improperly manage home units or outpatient facilities have things like this happen. So one more specific question about question about the difference between home and clinical units before we move to the second hour, which is how much pressure can you get in some of these home units? I know you have a company that sells units like this. I was stunned to find that these actually exist. I assumed that home units were only soft chamber, but in fact, I believe I saw that your chambers go as high as 2.0, maybe even higher. So how high do they go in terms of pressure? And what are the risks associated with operating your own chamber? Or do you need to, if you really want to be playing it safe, if you want to have a home chamber, you need to have somebody operating? How does that work?
So I always tell people if they're going to have a home unit, no matter what kind of unit it is, it's always a good idea to have some sort of level of supervision. Okay. Depending on the person, depending on the type of chamber, depending on how deep you're going. But the home market now, there are mostly soft chambers, mostly chambers that go to about 1.3 to 1.5 atmospheres. That's the majority of what's going on. However, over the last several years, especially through COVID and some of these other studies that came out, longevity studies in the Israeli literature, more people wanted to get 2.0 chambers for their house. And initially the 2.0 chambers were the same chambers that were coming from the hospital that required outside attendance and significant supervision. But these have been made safer over the years and to be made that you can actually operate them from inside the chamber itself. Now, if you're going to these deeper pressures though, I absolutely recommend supervision. But the difference, and we were alluding to this before, is that you're not pressurizing these chambers with 100% oxygen. You're pressurizing these chambers with oxygen that's coming through a mask or sometimes even a nasal cannula if it's a milder unit like the soft-sided units. And so we know that the risks of these chambers are quite low overall. Even at 2.0, the risks are relatively low. But
the risk is that you would get the bends, right? The risk is that there's a sudden change in pressure, presumably. Or maybe you blow your eardrums out because the pressure when you're pressurizing too quickly.
Yeah, the risk is mostly to your ears. The risk is that if you don't understand what you're doing hyperbaric therapy for and what kind of pressures you need and what kind of risks that you have. I mean, the challenge that I found, and one of the reasons I got more involved in doing more speaking about hyperbaric therapy many years ago, and especially through COVID, is that it's become the cowboy kind of thing. So there's all these companies that are coming in the United States, selling people chambers. Nobody has any clue what they're doing. And these companies don't give you any parameters really about what you're supposed to do and what you're not supposed to do. And I have seen people get into trouble. And like the worst things that can happen in chambers, that you get a seizure, for example, or you get a lung injury, which is very rare, but I have seen it. And this is because you're not using it effectively, or you're not using it appropriately, or you're not using it the pressures that would be most appropriate.
Or you're not taking the appropriate number of air breaks. I mean, you can experience oxygen toxicity as a result of not doing this correctly, right?
Especially the deeper pressures, right? So if you're at 2.0, you're doing a lot of hyperbaric therapy, you're not taking breaks, air breaks, you're not taking breaks, you're just doing it every day. Like this is how you can get into trouble for sure. And so I think that they're actually really, really safe devices overall, especially the mild units that go to 1.5. They're very, very safe and they can be used effectively for a huge proportion of people, if they understand why they're using it, and they're not using it every day, but they have various types of protocols that they can use over time. And that, I didn't get into the business of hyperbaric therapy because I cared about the chambers as much as I cared about that people didn't understand how to use these things in the context of what their goals were and the integration of other devices and technologies and practices that they were using around it. And that's what OneBase was really set up to do, was create an ecosystem where people could use these in a safe way. I mean, the first slogan that we had was better, safer, and faster, right? And I cared about the safer portion most importantly. So people didn't know, and they still don't know why they're using the chamber. And then they call me and they like, well, Dr. Scott, I got this chamber. I've been using it for 6 months. I don't know what I'm supposed to feel like. I don't feel very good. And I'm like, did anybody ever tell you what you were supposed to do? And the answer is no, right? So people get in trouble that way. But I do think that there's a huge opportunity in the home market too, because these are hugely important and helpful for healing in all the ways that we just described. So you can leverage it in these capacities, but you have to be mindful of how you're using them over the long term. And my sense is that you have people that with saunas and cold plunges and you have exercise equipment in your house. You're going to have a hyperbaric chamber at some point in that mix if we can get the price down, which I think will happen over time. But the key is the ecosystem and how you can integrate that particular technology, this one, with all the other ones that you have. And that's really what OneBase Health was set up to do. So in the end, I was trying to figure out a way to all these companies coming into the United States, throwing chambers in the market. It's like, holy shit, like we got to do something here to kind of try to regulate the flow of information so people at least understand how to use these things better, because it's already happening. And I have multiple people that I know that have chambers in the house to go to 2.0. I don't typically recommend any deeper than that usually.
Yeah. So I'm glad you brought up saunas. You didn't bring up red light therapy, but that's another one. Yeah. Cold plunges. There are many ways to leverage the benefits that you get from hyperbaric oxygen therapy, some of which I actually used in tandem. And that's something I want to talk about in the second hour. I also want to talk about frequency of use, optimal frequency of use, duration, protocol variations. I mean, I thought about this a bit when I was going through it, like, how varied can the protocols get? One simple variation that was introduced by the Israelis in one of their studies, which I asked to have implemented into my therapy to know, unfortunately, it wasn't approved, which was to add a third air brake. That speaks to hormesis, which is this concept of introducing stressors on your body that help your body improve, acclimate. It's kind of like Nassim Taleb's anti-fragile. In general, this is what I want to talk to you about in the second hour too, Scott, which is this is a treatment modality or philosophy, maybe a better way of putting it, that I see it's one of the most powerful philosophical forces in rejuvenation science. There's this concept of hormesis. Sure. And I found it was also true in hyperbaric therapy. So I want to talk to you about that. Also, how long do results last? What is an appropriate maintenance protocol? Fasting protocols, both for their own use as well as in conjunction with hyperbaric oxygen therapy. Intermittent fasting has become very popular in recent years, but there are other forms of fasting like block fasting, fast mimicking, dry fasting. So I'm curious to understand how that works. I know, for example, that getting into ketosis was something that was advised to me to do during the course of therapy. I didn't do it because it's not necessarily easy to do, but that's an example of it. Also, optimal pressures, the effect on telomere length, and we talked about stem cells. There's so much that I want to discuss with you in the second hour, Scott. For anyone who is new to the program, Hidden Forces is listener supported. We don't accept advertisers or commercial sponsors. The entire show is funded from top to bottom by listeners like you. If you want access to the second hour of today's conversation with Scott, head over to hiddenforces.io/subscribe and sign up to one of our 3 content tiers. All subscribers gain access to our premium feed, which you can use to listen to the rest of today's conversation on your mobile device using your favorite podcast app, just like you're listening to this episode right now. Dr. Sherr, stick around. We're going to move the second hour of our conversation onto the premium feed. If you want to listen in on the rest of today's conversation, head over to hiddenforces.io/subscribe and join our premium feed. If you want to join in on the conversation and become a member of the Hidden Forces Genius community, you can also do that through our subscriber page. Today's episode was produced by me and edited by Stylianos Nicolaou. For more episodes, you can check out our website at hiddenforces.io. You can follow me on Twitter at Kofinas, and you can email me at info@hiddenforces.io. As always, thanks for listening. We'll see you next time.